Is there an ideal way to sleep train, one size fits all model?
Definitely not. When we talk about sleep training, usually people mean some form of encouraging independent sleep. There's a lot of variations, but it almost always is in the service of trying to encourage a kid to fall asleep independently and to connect sleep cycles. So when we sleep, all people, including kids, we wake up about every 90 minutes between sleep cycles. And so good quality sleep for kids and for their parents. When you say a baby's sleeping through the night, you don't mean that they're literally asleep the entire time. You mean that they are going back to sleep on their own after they wake up. Sleep training usually involves some kind of crying. Sometimes people worry that this will cause long-term attachments. We have a lot of data on this that suggests that that's not true, including some randomized data, some community-based data. There's a lot of evidence that sleep training is not damaging to children, and also a fair amount of evidence that it improves sleep for parents and that it causes improved sleeps for kids in the sense of allowing them to connect these sleep cycles. Now, having said all that, based on the data, that this should be in people's toolbox. When you think about what am I going to do about the fact that we need to sleep, my kid needs to sleep, sleep is really important, it's not going to be the thing every parent pulls out of their toolbox. One of two things is sustainable. One is some kind of sleep training where the kid's going to sleep independently and they're going to sleep for extended periods of time, and the other is co-sleeping. These can work really well for different families. The thing that actually is very hard is I'm not sleeping in the room with my kid, but they're waking up every 90 minutes and I have to go put them back to sleep. That's really unsustainable for almost every family. You want to ask yourself, where are we trying to go? Are we hoping to all be sleeping together in the bed, which can work for a lot of people? Or are we hoping to be sleeping independently? How are we going to get there?
Is there a right age to start sleep training if that's the choice you make?
Not before 4 or 5 months. And at that point, you are not looking for your kid to sleep all the way through the night. So many of these sleep training approaches there are about learning some independent sleep, then sort of putting together a schedule where you think, okay, at some point they will need to eat in the middle of the night. And then as they get older and they need to eat less, they'll connect more of those things and eventually have a longer sleep.